My name is Patrick McKeown, and I live in the west coast of Ireland, but I teach the Buteyko method internationally. I first came across the Buteyko method back in 1997, and at the time I had very, very severe asthma. I'd also sleep disorder breathing. I was snoring. I was told I was holding my breath. I was waking up very tired. My concentration was affected. So I heard about the work of this Russian doctor in the newspaper at home, and I contacted the Russian embassy and I made contact with the people in Russia, and I found the basis of his method. The basis of his method is that while we need to eat a certain amount of food each day, we also need to breathe a certain amount of air each minute, every hour, every day. But modern life changes this. It exerts an influence on our breathing, and it makes us breathe heavy. And for 20 years, I was going around with my mouth open. I had my mouth open during sleep, and this was in turn affecting my respiratory complaint. For instance, it was causing my wheezing, my breathlessness, it was causing my fatigue, it was causing my snoring. So I simply learned how to unblock my nose using his method and make the switch from mouth to nasal breathing. And in that first day, my wheezing decreased by about 70%, and that was after 20 years of doing it. Now, I never intended working in this field. It was a couple of years later that I decided that, yes, this is really, really good. And at that time, I was needing no asthma medication. My concentration had improved profoundly. My sleep was better. I was calmer. And overall, there was no comparison in my health as compared to when I was going around with my mouth open, heavy breathing. Well, when we look at breathing volume, most people in the Western world believe that it's good to take big breaths into the lungs. I have to correct that. When our breathing is undetectable, when it's through the nose and it's silent and it's effortless, our blood is almost fully saturated with oxygen. We cannot take any more oxygen into the blood by breathing heavier than normal. Now, the reason I say that is because how many times you will hear stress counselors, Western yoga practitioners, sports coaches, people involved with the media, and they often give the instruction, take a deep breath or take the big breath. And taking a big breath, it doesn't add any more oxygen to the blood. It's physiologically impossible. However, it does get rid of a gas called carbon dioxide. Carbon dioxide is not just a waste gas. We need a certain amount of it for normal functioning. And I'll briefly go through the functions of carbon dioxide. 1, it relaxes smooth muscle that surrounds the blood vessels, the smaller blood vessels, the respiratory tract, the gastrointestinal tract, and more. It's estimated that there's 300,000 kilometers of smooth muscle throughout the human body. When we breathe too much, when we go around with our mouth open, we lose carbon dioxide and smooth muscle constricts. So it actually reduces circulation of blood throughout the body. It also causes the airways to constrict. The loss of carbon dioxide causes smooth muscles surrounding the airways to constrict, and that produces symptoms such as asthma, wheezing, coughing, breathlessness, etc. Say, for instance, the application of the Buteyko method, it helps people with asthma and breathing complaints. It helps with sleep disordered breathing, such as snoring and sleep apnea and insomnia. It helps mental complaints such as anxiety, panic attack, and ADHD in children. It helps cardiovascular complaints such as tachycardia, arrhythmias, palpitations, and it was discovered for the treatment of high blood pressure. It also helps children with craniofacial or the prevention of craniofacial changes. For example, children who mouth breathe tend to develop a narrow facial structure, a V-shaped top jaw, overcrowding of teeth, higher upper palate. In other words, there's a change in the development of the face when the child is growing up if they have their mouth open. So the application of the Buteyko method is to the most common diseases and conditions of modern civilization. Now, breathing too much, if I give you numbers, normal breathing volume is about 4 to 6 liters of air per minute. And if we look at people with asthma, people with obstructive sleep apnea, cystic fibrosis, diabetes, chronic fatigue, cardiac problems, they breathe between 10 and 18 litres of air per minute. And I've seen many, many studies. Many people in the Western world, probably the majority of the population, are breathing a volume of air greater than what we require, because it's paramount to modern life. And what I do is I teach a person how to bring their breathing volume down towards normal. So I bring in an asthmatic who's breathing between 10 and 15 litres of air per minute, and I show him how to bring it down to between 4 and 6. And with that, we can change their condition. Because even though it's well recognized that people with asthma breathe too much, it's often taught that, yes, they breathe too much in order to compensate for the feeling of breathlessness that they have. In other words, if you can imagine your airways are tightening, and as your airways tighten, you feel that you're not getting enough air. So the natural reaction there is to start taking more air into the lungs. However, it's not just that the overbreathing is because of the asthma. The overbreathing is also feeding back into the asthma. Because as we overbreathe, we're losing the gas carbon dioxide. This is causing smooth muscles surrounding the bronchioles, the airways, to constrict. It's also causing a cooling and dehydration of the inner wall of the airways, and this is leading to inflammation. Davis and Fried, they conducted research into mechanically ventilating dogs with cold, dry air, and they were able to produce the same inflammation in the lungs of the dogs as found in human asthma. Now, if we think of the nose as the natural filtering mechanism of the human being, the nose, we take cold, dry air into the nose, and the nose will warm and moisten the air before it enters the lungs. The vast majority of asthmatics do not breathe through their nose. So they bypass the natural filtering mechanism. They take the air directly into their lungs, and as a result, they're unknowingly feeding their condition. So the heavier they breathe, the more their condition is deteriorating. And I would say, as an asthmatic myself, and as somebody who had asthma for 20 years, and I know the experience of it, I know what it's like as a youngster, as a young child, to wheeze while carrying a school bag on my back. But I also know what it's like to breathe effortlessly. And the problem with asthma, it is a breathing problem. So let's look at how an individual breathes. What are they doing incorrectly? And that's what we look at. We say, yes, we look at your breathing. We see the excessive movements, often of the chest. We see the noticeable breathing. We see the sighing. We see the mouth breathing. And we work to address that. I often ask my students, put their hands on their pulse, take a few big breaths in and out of their mouth, and they start to notice that their pulse rate increases. So taking that into a physical exercise, where one can be breathing 100 litres of air per minute and more, what effect is that having? Are we actually starving the heart of oxygen by forcing the body to compete in physical exercise with very intense breathing? So it's imperative to teach an athlete, or for an athlete to be aware of the negative effects that overbreathing has on cardiac functioning. There's a significant relationship between breathing and stress and anxiety and panic attacks. So if you think of your normal individual who's prone to modern living and is breathing heavier, and they then get into their car, and as they're driving their car down the street, there's trucks coming, there's cars, and the stimulation brought about by the traffic makes them a little bit stressed. So they start breathing heavier. But as they breathe heavier, they get rid of the gas carbon dioxide. So the gas CO2 is produced internally, but when our breathing increases, we lose it because we exhale it from the lungs, and obviously it reduces in the blood. The loss of carbon dioxide is causing blood vessels to constrict. Gibbs in 1992, he estimated that the carotid artery to the brain, which is the main blood vessel to the brain, can constrict by up to 50% as a result of overbreathing. So you think of the individual that's in their car, they're getting stressed from the traffic, Their breathing increases, they lose carbon dioxide, they have reduced blood flow to the brain. Now, the brain that's getting less oxygen is going to get excited and is going to stimulate the individual to breathe even faster. But of course, this is only going to feed into the individual's stress levels. When we're stressed, we need more oxygen going to the brain, not less. It's really important that when we're stressed or when we're anxious, that we keep our breathing calm and quiet. In other words, we keep our body under normal conditions and not to react to the effect that the stress is having on us, and not to contribute to the stress by taking the big breaths. So it's estimated that in technical terms, we need an amount of CO2 in the lungs. It's 40 millimeter of mercury pressure. And with that, you have an equal amount in the arterial blood. But every 1 millimeter drop of CO2 reduces blood flow to the brain by 2%. Now, we can halve the amount of CO2 in the lungs within about 2 minutes. And it takes about between 2 and 9 minutes to significantly reduce CO2 in the blood. So an individual who is heavy breathing can be and is causing reduced blood flow to the brain. And with reduced blood flow going to the brain, we've got increased neuronal excitability. It generates tension, it generates more excessive thinking, more active thoughts, and active thoughts are worry. So my approach, as based in the book Anxiety Free, is to teach the individual not just when things are going wrong, but when things are going right, to change your breathing. In your everyday life, change your breathing. Calm your breathing. Slow down your breath. Relax your breath. Breathe in and out through the nose using the diaphragm. And then you have a cushion so that when stress does come along, you're not on the brink of symptoms. The instruction to take a deep breath is actually correct. However, deep is not big. An animal deep breathes. A baby deep breathes. But if you look at their breathing, it's not heavy. And for most animals, with the exception of a dog, it's in and out through the nose. A deep breath just means that we're using our diaphragm with a gentle, controlled, calm, slow, effortless breath. It's the entire opposite to what we usually take when the instruction is gave to take a deep breath. In order for you to change your breathing, you need to bring your attention to it. And as soon as we start following and observing the breath, we're taking attention out of the mind, into the inner body, onto the breath. We're doing a meditation, but it's even more, because we're gently encouraging breathing to relax, to allow carbon dioxide to slightly accumulate in the blood, to open up the blood vessels. So we're not just doing a meditation, but we're improving oxygenation of the brain. Now the feedback to this would be that an individual who does this properly, through relaxation, will feel warmer in a matter of minutes. Increased warmth is a sign that your circulation has improved. The hands feel warmer, the face can feel warmer, the upper body can feel warmer, the feet can feel warmer. So most individuals, many that heavy breathe, they have constriction of their blood vessels. They have impaired circulation. And sometimes, it takes the experience that one is feeling warmer to realize that, yes, we're on the right track here. There's a direct physiological response to when your breathing is calm, to when your breathing is gentle, to when your breathing is quiet. Free radicals, they're molecules generated through the breakdown of oxygen, and they're part of our normal metabolic process. Now, when we breathe, free radicals are generated. Generally, it's not a problem because we have antioxidants, such as vitamin A, C, vitamin E, which help to neutralize them. However, an imbalance can occur when our breathing is heavier than normal. Now, the problem with free radicals is that they generate what's called oxidative stress, or they attack other cells. And they have been implicated in a number of studies in aging and also in the development of disease, including cancer. So if we think of an individual who is breathing in excess of normal metabolic requirements all of the time, we have to ask the question, do they have an increased production of free radicals? Is there an imbalance between their production of free radicals and what can be neutralized by their antioxidant capacity? And is their heavy breathing contributing to the onset of aging, disease, including, as I said, different conditions, including cancer? On that basis, it's imperative that we learn to bring an individual's breathing volume down towards normal, so that there's a balance between the production of free radicals and their neutralization. Going forward, like really what we're talking about is, how can you breathe in order to better oxygenate the body? If our breathing is heavy, it's causing blood vessels to constrict, it's causing a left shift of the oxyhemoglobin dissociation curve, and without going too technical, it just means that the red blood cells are holding on to oxygen instead of releasing them. When we change our breathing from heavy back towards normal, we have better oxygenation of the entire body. And that's what we talk about. Now, there's a number of things that you can check. We have, for instance, a breathing test that's available on our website, buteyko.com. There's also a measurement that was developed by the late Dr. Buteyko. It's called a control pause. And you can also see this video. It's available on buteyko.com. So you can measure your own control pause and you can get some feedback on your own relative breathing volume. The rule of thumb is the lower your control pause, the heavier you breathe. And the heavier you breathe, it can be influencing and affecting different organs and conditions and setting you up with different complaints, ranging from possible respiratory complaints to brain fog to snoring to the conditions that we outlined at the very, very start.